Hello all, this is Archana, Assistant Professor, SNS College of Physiotherapy. So today we are going to see a case study. Okay, so assume that there is a patient, he is having 34 years old male, he is telling he is having pain over the elbow. Okay, so the patient is telling that the patient has pain over the outer side of the elbow and this pain he is having since 3 weeks. Okay, so first you see what kind of pain. Okay, so if this is a elbow pain, so what kind of condition the patient can have? So what are the conditions that affect the elbow? Name some conditions. Tennis elbow, then golfer's elbow, then
student's elbow.
Okay. So the patient is telling the pain is over the outside of the arm. So what can be? It can be tennis elbow. To diagnose this is tennis elbow, what you need to ask first?
From when it is started, the pain?
We need to ask the history. Okay.
Yeah, history.
So while moving on to the history, first what you need to ask? We need to ask about the aggravating factors, what is causing the patient pain. Okay, so while we ask the patient is telling the patient has pain while lifting any heavy objects or while playing tennis. Now what we need to ask?
How long the patient suffering from
pain? Okay, so you need to ask also what is the time it is getting aggravated and what is the time it is getting relieved. Okay. So to diagnose this as tennis elbow, what all special tests you can do?
Cousins test.
Okay, so you need to do Cousins test. So how you will do Cousins test? What is the position of patient and what is the position of therapist? Someone come here and demonstrate. One can be a patient and one can be a therapist.
No. Yes. So this is the patient now. So he is coming from the condition of lateral epicondylitis. So we are going to test the Cousins test. So we want to lift the patient's arm as 90 degree, and we ask the patient to flex the wrist, and we want to resist the hand while he doing the extension of the wrist. So do extension. Yeah. So while extension, the patient feels aggravating pain.
Okay. So the positive test means the patient will be have pain while he is doing resisted wrist extension. You can see.
Yeah.
Good.
Thank you.
So after the special test, what all you need to ask the patient for investigation? Will you jump with X-ray or MRI, or will you prescribe painkillers, or will you provide rehabilitation? So moving on to the special test, you have diagnosed it as positive. Cousins test is positive. After that, what you need to do? Treatment. Okay. So you can either go with the investigations. You can go with investigation, then you can go with the treatment. So for tennis elbow treatment, what all the things you need to do? First, what you need to do? First, we need to tell the patient to rest. We need to ask the patient to rest for few days. Then you can give icing. After that, to relieve pain, what you can do? To relieve pain, what you can do? What modalities you can prescribe? Ultrasound. Basically ultrasound. Which aspect you need to provide ultrasound? Lateral aspect of the elbow. Okay. So commonly in tennis elbow, which muscle will be affected? Whether it is extensor carpi radialis brevis, whether it is biceps tendon, or whether it is flexor carpi radialis.
Extensor carpi radialis.
So it is
extensor carpi radialis.
Extensor carpi radialis brevis muscle. So the most common muscle it is affecting is extensor carpi radialis brevis. Okay. So after the treatment, you can prescribe resting, icing. Then you can prescribe exercises. Okay, so what kind of exercises you can prescribe? Concentric exercises or eccentric exercises? eccentric exercises. Okay, so eccentric exercises you can give, then you can also give ergonomic advices. Okay, so how to sit, how to lift weight and all you can provide. Okay, so this is all about tennis elbow and its treatment. Hope you have understood about the case.
Yes, ma'am.
Thank you.
Thank you, ma'am.